heart is the engine of life, beating over 100,000 times a day to pump blood to every corner of your body. But for millions, this vital engine is under threat. When the arteries feeding the heart become blocked, a bypass is often the only way to restore the flow. Today, we go inside the human body to witness coronary artery bypass grafting, or CABG, a procedure that builds a new road for your blood to travel. The problem begins deep within the coronary arteries, the vessels responsible for supplying oxygen to the heart muscle itself. Over time, cholesterol and fatty deposits build up on the inner walls, forming plaque. This condition, known as atherosclerosis, narrows the channel, turning a wide highway into a bottleneck that restricts blood flow. When the flow is severely restricted, the heart muscle downstream begins to starve. This area of tissue, deprived of oxygen, becomes ischemic, weak, pale, and unable to pump effectively. If left untreated, this starvation can lead to a heart attack where the muscle tissue permanently dies. To see the full extent of the danger, doctors use an angiogram. By injecting a contrast dye into the arteries and using X-ray imaging, the blood vessels are mapped in high definition. The dye flows freely until it hits the blockage, revealing the exact location and severity of the narrowing that needs to be bypassed. The solution often starts in the leg. The surgeon carefully harvests a section of the saphenous vein from the inner thigh. This vein is a spare vessel in the body, and removing it does not harm circulation in the leg. It will serve as the perfect biological tube to create the new bypass graft. To access the heart, a procedure called a median sternotomy is performed. An incision is made down the center of the chest, and the breastbone is carefully divided. A specialized retractor gently opens the rib cage, exposing the pericardial sac and the beating heart within. Because it is impossible to sew on a rapidly beating heart, the work of pumping blood must be handed over to a machine. Tubes are connected to the heart and major vessels, diverting blood to a heart-lung machine. This device takes over the job of breathing and pumping, keeping the patient's body oxygenated while the heart is stopped. With the machine running, a cold solution called cardioplegia is injected into the heart arteries. This fluid instantly stops the electrical signals, causing the heart to cease beating. It is now a still motionless organ, allowing the surgeon to operate with microscopic precision. On a sterile table nearby, the harvested vein graft is prepared. The surgeon flushes it with saline to ensure it is watertight and free of leaks. This simple vein is about to become a high-pressure artery, a lifeline that will carry blood for decades. The core of the surgery is the anastomosis. Using a suture thread thinner than a human hair, the surgeon sews one end of the vein graft to the coronary artery, just past the blockage. This delicate stitching must be perfect to ensure a leak-proof seal. The other end of the vein is then connected to the aorta, the main pipeline leaving the heart. By attaching the graft here, the surgeon creates a bridge, a completely new path for blood to flow from the aorta directly to the heart muscle, bypassing the blocked section entirely. With the bridge complete, the clamps are removed. Oxygen-rich blood rushes through the new graft, bypassing the old blockage. The pale, starved muscle tissue we saw earlier begins to flush pink, instantly revitalized by the return of fresh oxygen. It is time to restart the engine. The heart is warmed up, and if needed, a small electrical shock is delivered to reset its rhythm. The heart snaps back into action, beating strongly on its own. The tubes for the heart-lung machine are removed, and the patient's own heart takes over once again. To close the chest, the divided breastbone is brought back together. Strong stainless steel wires are threaded through the bone and twisted tight, locking the sternum into a solid structure that will heal as one. The skin is closed with dissolvable stitches, leaving a neat, clean line down the center of the chest. Sterile dressings are applied, and the physical phase of the surgery is complete. Inside, the healing continues. Over the next few weeks, the sternum fuses back together, becoming as strong as it was before. The steel wires remain safely inside, encased in the new bone, providing permanent stability. The result is a new lease on life. The patient returns to their daily activities with a heart that is now fully fueled and functioning. The bypass graft works tirelessly, supplying the energy needed for a long, active life. From a silent blockage to a revitalized beat, heart bypass surgery is a marvel of modern medicine. Thank you for joining us on this journey inside the human body. For more incredible medical visualizations, subscribe to Surgery Visualized.